Hello, everyone. This is Chris Haromy from the Lung Health Foundation. I hope you can hear me okay. Welcome to our presentation on COPD, taking control of COPD. So today I'm going to be taking you through a series of PowerPoint slides. It's going to be showing you different things related to diagnosing COPD, how it's treated, all the different management strategies that can help. And then after that, Kori Evoy, who's a respiratory therapist here in Sault Ste. Marie, will be showing you a couple devices that are very useful to ensure that, first of all, you're using your inhalers properly, and also for those who require oxygen, it will be a couple devices that are used for taking it on the road, the portable oxygen devices. So let me share my screen and then we can start the presentation. Okay, so taking control of COPD. And I'm sure most of you know, but COPD stands for chronic obstructive pulmonary disease. Chronic meaning it's long-term, obstructive meaning that your airways and some of the damage that's occurred in the lungs makes it more difficult to get air out of your lungs. Pulmonary, of course, means lungs, and disease means something's not quite right, not normal, occurring in your body. So we have, as I said, two speakers today, myself, I'm a respiratory therapist and certified respiratory educator with the Lung Health Foundation. And then we have Kori Evoy, who's also a respiratory therapist, certified COPD educator, and works at Northern Respiratory and home care, as well as I believe in the Sault area hospital. So she'll be joining us later to present on those devices. So learning objectives for today, we're going to define COPD and identify key ways that it's diagnosed. Sometimes it's not diagnosed as well as it should be. So we'll discuss some of the key ways it's diagnosed. Determine strategies that can help manage COPD and improve your quality of life. The reality is with COPD, your lungs just don't work quite as well as a person who doesn't have COPD. And some of the strategies are to improve the control of COPD, improving the lung function, but the reality is the lungs just don't work quite as well as they used to. So, and varying severities of COPD, of course. So a goal is to improve the quality of life, all the strategies that can help to make your life better when your lungs don't work quite as well. And then Kori is going to show you the InCheck Dial, which is a very cool tool that helps you gauge whether you're taking the inhalers properly, especially how well you're able to inhale the medicine into your lungs. If it's not inhaled at the right speed, you wouldn't get the medication quite as well. So it's kind of nice to know if you are getting the medication properly. And then we're going to be demonstrating the portable oxygen device, a couple of cool devices that you can take with you. You know, there's some advantages to that, of course, when you're out and about. There are, of course, cylinders that are heavy, but, you know, portable oxygen concentrators are a very good option in many situations. They do have some weight, of course, too, because batteries do weigh quite a bit. And then at the end, just identifying where you can learn a little bit more about COPD if you ever have questions. And we'll open it up to questions at that point at the end. So if you do have any questions, there's a chat function. You can enter any questions there. We'll take a look at them at the end and see if there's any questions we can help answer. So what is COPD? It's a disease that makes it difficult to move air in and out of the lungs. So there's two main aspects to COPD, chronic bronchitis and emphysema, and I'll show you what they mean with some pictures coming up. But basically, the airways are inflamed and they become obstructed. That's where the chronic obstructive part comes. It's obstructing the flow of air. The air is not able to get out as well generally, also in, but mostly can't get the air out as well. And that makes it difficult to breathe. So you get the difficulty breathing and shortness of breath. There is no cure for COPD at this point, and I can't imagine it'd be in many decades, but there's lots of good ways to manage it, and including inhalers and self-management strategies, which we're going to cover. So chronic bronchitis, that's one part of COPD. And people have varying levels of each chronic bronchitis and emphysema. So in some people, it might be more chronic bronchitis. You've got extra mucus, all congested from the thick mucus, and some of the strategies will be different for someone who has maybe more strictly emphysema. They don't have extra mucus. So you can learn that fairly quickly. Like you cough up excess mucus more than say people of similar age, and is it unusual compared to other people you know? In which case you might have chronic bronchitis aspect of COPD. So you can see in these images depicting the airways of the lungs. This is a normal bronchus or airway, and below that is an inflamed bronchus. So the lining gets inflamed and swollen. You've got excess mucus building up. You can imagine getting the air in and out of that would become more challenging, especially when you exert yourself. So some of the strategies will be, related to trying to remove that mucus, which can also be a liability in terms of causing infections over time. And then the other aspect is emphysema. So here we have, at the end of these airways, we have these balloon-like structures. They look like a cluster of grapes. Here's a nice, healthy, normal alveoli, and this is where we exchange oxygen into the blood that surrounds these little balloons, and we remove the waste gas, carbon dioxide. So they get moved in and out of the lungs. Oxygen come in, CO2 goes out, carbon dioxide. So when you have emphysema, there is damage to these walls of these grape-like structures. So the walls get damaged, and it makes it harder to clear the mucus out of there. It makes it harder to get air in and out. You lose a lot of the elastic recoil. So when we breathe in, we use muscles to breathe in, a lot of our diaphragm and some muscles around our ribs and so on. But when you breathe out passively and just let it come out naturally, that's actually mainly from the recoil of these alveoli. So the elasticity pushes the air out slowly. When you don't have that elasticity, the air doesn't get pushed out as well. So you get air trapping. It's called air trapping. And when you get air trapping in there, that air gets full of CO2 and there's not as much oxygen. And that's where you get shorter breath. You get less oxygen in your blood. And so some of the strategies we'll show you is how do we get that stale air out of the lungs, like using strategies like pursed lip breathing, diaphragmatic breathing. Okay, so who gets COPD? Doesn't usually affect people under 40 years of age, sometimes, but not very often. Usually, folks are diagnosed when they're 60, 65 and above. Now, having said that, it is often undiagnosed for many years. So there are probably a lot of people who have COPD who don't realize it. It does affect more women than men, not an inordinate extra amount, but it does affect more women. Possibly they're more likely affected by the harmful effects of tobacco smoke, and women generally develop COPD earlier than men. So about 15 to 20% of smokers develop COPD. We definitely, studies have been showing that it's likely a lot more than that because there's a lot of people out there who have COPD and don't know it. They're just not diagnosed. And we'll go over reasons why that happens. But smoking causes about 80 to 90% of COPD cases. But there are many people, 10 to 20%, who never smoked before. They might have been exposed to secondhand smoke. They might have a genetic abnormality called alpha-1 antitrypsin deficiency. They may have been exposed to secondhand smoke. Is quite common. It's quite common that occurred in my childhood as well. Also having lung infections as a child has been found to potentially be a risk factor for developing COPD. It is a major cause of death and disability. Approximately 12% of Ontarians have COPD, and it's the fourth leading cause of death in Canada. I believe third leading cause of death in the world. And it causes more hospitalizations than any other major chronic illness. So it's quite significant. It's usually, if you'll know somebody who has COPD amongst your family and friends. It's approximately 1 in 10 people have it. How is it diagnosed? Well, there's a series of steps that are taken. So it's generally based on a medical history, a physical exam, and some tests. So let's go over that. So medical history, basically your healthcare provider is going to ask you questions, a whole bunch of questions. What kind of symptoms have you had? Have they been going on for more than a few weeks? Have they been going on for months, maybe even years? What irritants are you being exposed to? Are you currently exposed to, like smoke or workplace exposures? Any health issues that you and your other family members might have that might increase the chances that you have COPD. Physical exam, it could just be looking at the breathing patterns, listening with a stethoscope. You might hear gurgling if there's mucus in there. Might hear decreased lung airflow in the lungs. And there's other signs you can look for COPD in the chest and lung area and other parts of your body. Maybe if you're not getting enough oxygen, you might have swelling in your ankles. So the challenging part of diagnosing COPD often is that the symptoms come on slowly. It's called like an insidious onset. You don't notice it. It comes on slowly and builds over years. So these symptoms like shortness of breath, especially when you exert yourself, go upstairs quickly, they're often mistaken for being out of, people blame it on being out of shape or getting older. And don't see their family doctor or nurse practitioner about that to get assessed. The earlier the diagnosis, generally the more effective the treatments, and you can help prevent exacerbations or flare-ups that can damage your lungs over time. So spirometry, this is a very important test. If you haven't had it done, it's important to have that to really confirm the diagnosis of COPD. It's not a difficult test. You do have to give a really good effort. So you have to breathe out, big breath in, and breathe out as hard and fast as you can into a mouthpiece, which is connected to a laptop or some kind of a computer system. And the spirometer reads all those flows and volumes, and compare it to someone your same age and gender and height and so on. And is it below normal? Is it below normal? Is it out of the range where it should be? And if that's the case, that's a very good test to show that you have that obstructive part. So there's a whole bunch of tests that can do like outside of that spirometry as well. But the main one is spirometry for checking your lung function. And it's available in various places, sometimes a doctor's office, but more often in a hospital or a clinic. So other tests, there's other, as I said, other lung function tests that can check volumes in your lungs that spirometry doesn't assess, or how well you're able to transfer oxygen into your blood. You can even test that. Oxygen saturation, some of you may even have those devices. They become a lot more common and inexpensive. So they used to be in the hundreds of dollars, now maybe under $100 for a good oxygen saturation monitor. So if your oxygen levels are too low in your blood, that's a part of a diagnosis. Imaging, lots of imaging can be done. X-ray can show some things. More likely that it's not done or can just be used to rule out things like pneumonia. Sometimes a CT scan would be done. That's very good at showing emphysema, but an X-ray can as well. Blood tests, especially if they're suspecting a genetic condition like alpha-1 antitrypsin. But if you're in an acute situation, they might do one of those blood tests from your wrist that kind of hurt a little bit, and take arterial blood and check the levels in there to make sure your carbon dioxide and oxygen levels are normal, and the acidity as well, the pH. So there are other lung function tests, a series of those that can be done, especially if it's not conclusive, the first tests. But those are options, not in every center because they're a little more specialized. And we do have a quick self-assessment test. So if you're over 40 and smoke or used to smoke, there's a series of these questions you can ask yourself. So do you cough regularly or cough up phlegm regularly? Do you do simple chores like, or even walking up the stairs relatively quickly, make you short of breath? Do you wheeze when you exert yourself or at night? Do you get frequent colds that last longer than those of other people you know? And often we'll compare these questions to other people you know. Do they have any problems when they exert themselves? Is mine unusual? But if you do answer yes to any of these questions, it's a good idea to see your healthcare provider and get a spirometry test. That's usually one of the first steps. Okay, so now we've discussed the diagnosis and some of the statistics. So how do we manage COPD? We know it can't be cured. We do know that there are a series of excellent measures that can help manage the COPD and improve the function of the lungs. So there's great benefits to it. You've got reduced symptoms, reducing the risk of having a flare-up or exacerbation is very important because that can actually make your COPD worse over time. If you have an occasional one, usually not too bad, but if you're having regular flare-ups, there's a series of steps that can help. We'll go over that. And then managing your COPD well, just there's numerous quality of life questionnaires that can show that your quality of life improves quite a bit when you manage it well. So, I mean, if someone's still smoking, yes, definitely quitting is the single most effective way to slow down the worsening of the lungs. You're getting direct smoke. I mean, secondhand smoke would also be a factor. Any kind of noxious substance in the air, if you can avoid those, your lungs don't like to have those in there, and cleaner the air, the better. So what happens with COPD, and I show this slide because it really points to a series of ways we can help people with COPD. So when you get short of breath, this is an anxiety, shortness of breath kind of cycle that occurs. Shortness of breath leads to anxiety, which leads to shallower breathing, which leads to muscle tension, which leads to more shortness of breath and tiredness and less energy for doing the things you need to do and like to do, which increases your anxiety and so on. A big cycle here that happens with a lot of folks with COPD. So we want to try and stop that motion of this cycle, address anxiety, address the shortness of breath and tiredness. So we'll go over a series of steps we can do to help with that. So there's also the downward spiral of inactivity, sort of like a pictorial that we've used many times. Basically what happens with COPD, because you get short of breath, you start decreasing your activity. And the unfortunate reality is that when you decrease your activity, that increases your shortness of breath. So one of the main strategies with COPD is staying active and getting a regular exercise routine going. A daily basis is ideal, but use your judgment based on how much energy you have and what you're comfortable with. But the reality is, if you stop being active, you'll become more short of breath over time, doing less. Just when you're active, you get so many benefits, physical, mental benefits from activity and socializing and exercising, that the research is very solid in that area, a very important aspect, not just in general for life, but specifically for COPD. Regular exercise is very important. So the benefits include allowing you to do your usual daily activities that you need to do, shopping, socializing, sports, etc. Whatever you need to do and like to do. So bathing, showering, etc. You're going to be using, when you're more fit, you're going to be using your oxygen more efficiently. And when you use more oxygen more efficiently and your muscles are more efficient, you're using less energy. And when you have more energy, you have more energy to do other things. And it also leads to less shortness of breath. with a series of different types of exercise, aerobic training. That can be, when you get your heart rate and your breathing rate up, it could be walking, it could be treadmill, stationary bikes, or whatever you like to do. And it could be in your home. We have a series of videos where you can do things in your home. Resistance training, that just means like you're using a resistance to train your muscles. That's been shown to actually improve the efficiency of your muscles and reduce shortness of breath and help with COPD. So it could be very light weights, 1, 2, 3 pounds. Could be a bottle of plastic bottle of water. TheraBands, which are these elastic bands that you can use to do a series of exercises. And then flexibility is important as well. So flexibility and stretching, it improves your range of motion, allows you to continue doing your exercise. So ideally, where there is a rehab program, a pulmonary rehabilitation program, it's good to be referred to one of those. People I've spoken with absolutely love them. They learn so much, and they learn the value of exercise. And they're not available everywhere. I know here in Sault Ste. Marie, they had one. I think it was closed during the pandemic, but I'm sure they'll get back up and running. There's also exercise maintenance programs, such as our own Fitness for Breath program. So actually, let me try and click on this. I can show you. So yeah, so here's our Fitness for Breath splash page. We've got classes. I think they're generally booking up quickly. We're trying to increase our capacity, but this explains at our website, lunghealth.ca, what it is, the goals of Fitness for Breath. And then we have a series of videos here you can do on a chair, however you're comfortable. So it's very practical for also in-home exercises. So relaxation techniques, because of that anxiety, and however you're comfortable, whatever strategy you're comfortable with, relaxation techniques could be, when you're feeling a little more stressed, there's a series that can be helpful. Positive thinking, visualization, where you're visualizing some kind of a calm environment that you love. Music can be very calming. Humor, yoga, meditation, and there's something called progressive muscular relaxation being shown to be helpful. So however you're comfortable, whatever you're comfortable with, find ways to improve your relaxation, because that can help reduce your shortness of breath. And when you're feeling anxious, which can happen, especially when you're getting short of breath, it can help too, and slow your breathing rate down and maybe make it a little more efficient getting the air in and out of your lungs. Now, I mentioned chronic bronchitis and the extra mucus. So not everybody has that, but there's a series of airway clearance techniques they're called. So that's basically fancy term for getting mucus out of your lungs. So we have some technique called the puff controlled cough technique. We have positive expiratory pressure device. I can show you that one. So this is an example called aerobica, and you essentially just breathe into it. And when you're breathing out, it actually you'll feel a little vibration. So it's essentially creating small little coughs, and that can help break up the mucus in your lungs. I can show you also here a short video, just to show you a few minutes of this video. So take a look at this, and we have a couple of these videos, and they're very good, very well done, very clearly demonstrated.
Do you have trouble coughing up mucus, also called sputum, from your lungs? At times, you may find that it can be quite sticky and thick as well, making it harder to breathe. Having a lot of mucus in your airways can also add to your chances of getting a chest infection, because bacteria can grow in the mucus. If you have a lot of mucus and cough a lot, you may find that you exercise less and avoid social occasions. My name is Isabelle Leclerc, and I'm here to show you how to perform a controlled cough using the huff technique, as well as a demonstration of an airway clearance device called the aerobica. airway clearance techniques may be recommended to help you cough up mucus more effectively. Keeping your lungs clear can prevent chest infections. When you know how to cough up mucus, it can also give you more confidence to exercise and participate in new activities. Being able to prevent chest infections and having confidence to participate in social activities can help you improve your quality of life. In this video, you will see how simple it is to make this part of your daily life and any exercise program that you may be participating in. We will go over important information and provide a demonstration of a controlled cough and how to use an airway clearance device called the Aerobica. A common airway clearance technique is called the controlled cough, which makes use of the huff technique. Follow these steps, and I will do a demonstration afterwards. Sit and support your abdomen. Put your hands on your tummy. Good posture is an important first step in being able to cough up mucus. Take a slow, deep breath in using your diaphragm. Your stomach should move outwards to build up air behind the mucus. Hold your breath for 3 seconds. 1, 2, 3. This will allow the air to get behind the mucus so the mucus can move up your airways more easily. Cough twice with your mouth open in the shape of an O using the huff technique. Coughing with your mouth open, also called huffing, allows the mucus that is deep in your lungs a chance to move from the smaller airways up to the larger ones. You may actually hear some gurgling, and that is good. It means the mucus is actually moving. Pause. Follow with one strong cough to clear the mucus from your larger airways. Then spit out the mucus. Rest, and then repeat these steps as needed. Now let's do a demonstration. Use the controlled cough technique in the following.
Yeah, so I just want to show you a bit of that. It goes on, and it does demonstrate also that Roca device. There are other types of these OPEP devices. Just means oscillating positive expiratory pressure device. Just fancy name. It means it vibrates when you breathe out. It kind of creates a little fluttering feeling when you breathe out to help break up the mucus. So other strategies include breathing techniques and energy conservation. The reality is, when you have COPD, depending on the severity, if it's mild, it wouldn't be much of an issue, but more moderate to severe, you're going to be using extra energy to breathe, and that saps some of the energy you need to do your daily activities. So some of the strategies managing COPD are related to actually conserving your energy. It sounds contradictory to getting regular exercise, but at certain points, you're going to be, it'll be important to reduce how much energy you're using so you can keep doing the things you need to do. So one of them is called pursed lip breathing, and there's body positions. It's going to show you a few minutes of this video as well, and we'll discuss the pursed lip breathing after.
Do you get tired when performing daily activities such as dressing yourself, cooking, or going up the stairs? You may notice that simple tasks and even breathing can tire you out. Having difficulty with everyday tasks can impact you physically and emotionally, sometimes making you feel anxious. In order to take part in a regular routine that includes exercise, try to pace yourself and conserve energy whenever possible. My name is Isabelle Leclerc, and I'm here to show you how to perform breathing techniques and use certain body positions in order to relieve shortness of breath, as well as review principles of energy conservation. The goal is to show you how to perform activities of daily living more easily in order to lessen your shortness of breath during activities and exercises. You will see how easy it is to do these during the day and when you participate in an exercise program. In this video, we will go over important information and provide a demonstration of breathing techniques and body positions that will help you manage your breathing as you go about your daily activities. Let's start with pursed lip breathing. The goal of pursed lip breathing is to be able to breathe out more air to avoid air being trapped in your lungs. You will feel calmer and more confident to handle shortness of breath. It is important to practice this when you're not short of breath, so you know what to do when you start to become short of breath. Use pursed lip breathing during or after exercise or with any activity that makes you feel short of breath. It can help you return to your normal breathing pattern. This technique can help you to reduce air trapping in your lungs, slow down your breathing, and reduce shortness of breath. It can increase the length of time you are able to exercise and the ability to perform exercises or a new activity. Here are the steps for pursed lip breathing. Start by trying to practice this while you are seated and at rest. Once you feel confident doing this, you can progress to incorporating it during your exercise routine, as well as in your day-to-day activities. I will do a demonstration after. First, relax your neck and shoulder muscles. Inhale slowly through your nose for about 2 seconds. 1, 2, while keeping your lips closed. Purse your lips as if you're about to whistle or blow out a candle. Exhale slowly through your pursed lips for about 4 seconds. 1, 2, 3, 4. This is the part I want you to focus on. Breathe out twice as long as it took you to breathe in, and remember not to force it out. Now let's do a demonstration. Practice this a few times. If you start to feel lightheaded,
Okay, so yeah, that demonstrated first pursed breathing. There are also body positions that can help when you're feeling short of breath and to reduce the amount of energy used and reduce fatigue. So yeah, there's the pursed lip breathing again. Relatively simple, takes a little while to master it, but it's also an excerpt from our booklet on COPD. You can get lunghealth.ca. And then there's also tools to conserve energy because, as I said, energy is important when you have COPD. It's vital to maintain energy so you can do all the things you like to do. Walking aids, like rollators, are great. A bath seat, raised toilet seats. They even have, toilet seats that are generally built now to a more comfortable height. A cart with wheels to carry items, maybe you're working around the garden, etc. A long shoehorn, which can help when you have to bend over a lot. It can be difficult when you have COPD. A dustpan with a long handle. I just ordered one on IKEA, so I'll be getting that before Christmas. Maybe that's my only Christmas gift. We'll see. Grab bars for the shower, tub, and toilet areas. So these can help not just for reducing the risk of falls, but just make it easier to get up. And then reacher tools, like these little clamps you can use to grab things that are hard to reach. A whole series of tools like that can be helpful. And then we do sometimes mention the 5 Ps. We've had these around for a while. So reducing shortness of breath and fatigue by prioritizing things. For example, if you're feeling better in the morning, have more energy in the morning, do certain activities then when you have more energy. Or say after you've used one of your inhalers and you feel you've got better lung function. Prioritize the things you need to do, before you're are doing the things you'd more like to do. But it's important to get the things you need to do first done. And planning. So planning, when you go to a grocery store, for example. I even do this myself. I don't have COPD, but I kind of like to make it more efficient. When you go through, I make my grocery list. I want to do it so I'm not going to be coming back and forth across the grocery store for getting items. So I plan it around where the natural route is of all the different items you're going to be getting. Pacing yourself. So the reality is your lungs, don't work as well. So it's important to slow down, catch your breath, take a lot of breaks. Don't stop being active, but taking lots of breaks, sitting down, and sometimes that's very good with the types of rollers you can sit down on, take a little break there. Some people plan their walking routes where there's a nice bench to sit on. The postures we mentioned in personal breathing. So, well, of course, I'm sure you all know inhalers are an important part of managing lung conditions. It's an advantage actually having a lung condition. You can get the medicine directly into your lungs without taking a pill that goes throughout your whole body. So you generally have much lower risk of side effects with inhalers. There's still some risks and some annoyances, but generally they're much safer than, for example, taking pills for conditions. So they do help reduce shortness of breath, and in some situations, if you're having a lot of flare-ups, taking, for example, a combination with an inhaled steroid can help prevent and treat flare-ups. We have inhaler videos at lunghealth.ca, which and other organizations have videos that demonstrate how to use them properly. You do get a sheet with each device. Sometimes it's very small writing, so to get the glasses out, a magnifying glass, because it's very tiny, but these videos are nice to also use. So we have different types of inhalers. The short-acting bronchodilators, a lot of people know those. They're usually blue, but not always. Most people would have some kind of a short-acting bronchodilator, usually for as-needed use, but sometimes it's taken on a daily basis. Usually it's some kind of a salbutamol or Ventolin, and various types of those you can see here. But sometimes it's an Atrovent, a little bit older medicine, but still useful, or a Combivent, which is a combination of this type and this type, the Atrovent type, in one inhaler. And then we've got long-acting bronchodilators. So they're also used to treat shortness of breath on a daily basis, taken once or sometimes twice a day. So there's a series of those. And it's important to note that, some people have preferences over types of inhalers. Some of them spray the medicine out. Some of them are called dry powder inhalers. So you inhale it and you're creating the nice powdery mix that goes deep in your lungs with your inhalation. And Kori's going to go over that tool we talked about to make sure you've got enough inhalation strength to take in the medicine properly. So these are basically taken on a daily basis. They're key to one of the key medicines for COPD is the bronchodilators. It just means that they open up the airways. So broncho means airway and dilator means it opens it up. And then sometimes they combine two different types of bronchodilators. There's two different types that chemically work differently in the lungs. So it's been found that if you combine the two, that can sometimes be more useful than with one alone. And they also treat shortness of breath. And then, as I mentioned, the steroid, corticosteroid, can sometimes be combined, especially if you're having regular flare-ups. It's been found to reduce your risks of these flare-ups, which, as I said, could damage your lungs over time. So, and it's also, at the time, can be kind of risky, ending up in the hospital sometimes. And then there's additional medications like azithromycin, sometimes taken on like an antibiotic taken on a daily basis, low dose. Theophylline or methylxanthines, not so commonly used, but still used, still useful. If you have a lot of mucus, thick mucus, N-acetylcysteine or NAC, sometimes short form too, can sometimes be useful to break up the mucus. They're not prescription. You can get them at pharmacies, maybe health stores, those kind of places. Some people do require prednisone on a daily basis. It's very useful. It's very, very powerful medicine. It can really help with inflammation in the lungs, and sometimes taken a low dose on a daily basis, sometimes taken only during an exacerbation or flare-up. And then there's a medicine called Daxis. If you have a lot of mucus and chronic bronchitis, it can be useful. Sometimes not tolerated so well. Sometimes the pills affect the stomach and makes it difficult to take sometimes. Vaccination is very important for prevention. That's one of the biggest reasons that people end up in the hospital with COPD is infections. So getting your annual influenza vaccine, they're out now. They've been out for a month or so. If you haven't had your pneumonia vaccinations or pneumococcal vaccinations, there's mainly usually just two types that are given, Pneumovax 23 and Prevnar 13. given at different times in your life, sometimes once, sometimes more than once. So ask your healthcare provider about that if you haven't had those. And then, of course, the COVID vaccines are very important for preventing infections in yourself and other people. And there's all sorts of measures to help reduce the chance of getting an infection. I think we've been told this on a daily basis for the last 3 years since the pandemic started, on washing our hands, using hand sanitizer, etc. We probably know that, keeping your hands away from your face, cleaning common areas in your home. If someone's sick, try and avoid them. If you put a mask on them, that will help a lot too, a good mask. Sneezing into a tissue or into your sleeve if you have to sneeze or cough. And of course, if you're not feeling well, then stay away from public places. So an exacerbation is defined as, or a flare-up is defined as being basically like a persistent worsening of your symptoms, significant worsening of symptoms that last at least a couple of days. Doesn't mean you don't start measures right away. It's just that that's how the medical community defines an exacerbation or flare-up, is a couple of days of this worsening. Sometimes called a lung attack as well. So it's important to know the causes of it and also help prevent them. It's a very important part of managing COPD. So it can be caused by an infection, smoking, secondhand smoke, or basically anything irritating to the lungs that you're inhaling, including air pollution, anxiety, and then very often it's it's an unknown cause. It just happens, and it's not necessarily determined why it happened. Some of the signs include, of course, you have your shortness of breath would change, or your wheezing would change. It might be more than usual. You might have a cough that you hadn't had before, or maybe your cough's gotten worse. The mucus might change in color or thickness, or the amount. Any of those three really would be an indication that you might be having an exacerbation as part of it. You're feeling more tired, lower blood oxygen levels. Again, if you have one of those saturation monitors to measure. Confusion, headache, and insomnia, that would be more if you're getting a lot of the CO2, carbon dioxide buildup, and CO2, what they call CO2 narcosis. You're just getting very, very worn out because you're not able to remove that CO2 gas from your lungs. So an action plan. So the COPD action plans are a very important tool to have. Not everyone has it, but it's important to ask about that with your healthcare provider or respirologist, depending on who you see. It explains what medication you should take every day, how to check if your COPD symptoms are getting worse, and if you're starting to get worsening of your symptoms, what steps you would take, which medications you would add on. And you'll see here also, in the green zone, you're feeling well. So you're going to, your sputum color is this. What should I do? Which medications would I take? Yellow zone, you're starting to get a little worse. Your sputum's change. You're more short of breath. And maybe you would add on additional medications at that time, or change the doses that you're taking of your current medication. Or if you're feeling much worse, call your physician, nurse practitioner, and get their advice, or get to the nearest emergency department if it seems very serious, of course. And then it might include some kind of a standing prescription for antibiotics. If your sputum changes, maybe antibiotics might be found to be useful for you. This may be something you determine over time with your healthcare team. Maybe you're feeling more short of breath. You're more at the bottom. So you might, start prednisone pills, steroid pills at that point. So it's important to have one of these action plans and work with your doctor or nurse practitioner to have one of those written out for you. This is just an example of one. So there are other ones good to have to help you be a little more proactive and really quickly get control of maybe an upcoming possible flare-up that could be occurring. So there's other types of help too you can get for COPD. So we've got support groups. We have a web page on our lunghealth.ca that lists support groups, including our own, which we run by telephone. Some are by video. A lot of people like in-person. We're going to be starting one up here in Sault Ste. Marie, an in-person support group. probably in January starting up. So it's, you know, depending on the pandemic and so on, the timing might be different, but that's the goal. People love being in person, but you know, we're also getting more comfortable with video and having very effective support groups by video. Work with your healthcare team. You know, that's an important part of managing COPD. A lot of community resources you can find that can be helpful. Meals on Wheels, grocery delivery can be, it's become more commonplace since the pandemic. So that can help, especially with the heavier items. Advanced care planning. Everybody should be, you know, thinking about advanced care planning, whether you have a lung condition or not. It's basically, it's deciding what kind of health and personal care you'd want at the point where you're not able to decide for yourself. So it could include a living, it should include a living will, which explains the treatments you want or don't want when you're no longer able to decide. And the terminology is a little different depending on the province, but that's sometimes a common way to describe it. Power of attorney for personal care and other types of areas like financial care and so on. So you determine who's going to be your substitute decision maker, who speaks for you when you can't speak for yourself. So there's a good website, advancedcareplanning.ca, which is very useful and has lots of good tools. Okay, so I'm going to be passing the podium to Kori, fellow respiratory therapist working in the Sault Ste. Marie community. So she's going to show you the InCheck Dial to start with and demonstrate that. I might be able to help too, depending on how we can fit the screen. But
yeah. Hello, I'm Kori, as Chris said. And I just want to kind of show you guys this one tool that we like to use at Northern Respiratory, like Chris had mentioned. It's called the InCheck Dial. And basically what this is it's a tool that helps us to understand whether or not you're taking your inhalers correctly. Because every inhaler, you know, you have the typical Ventolin, and then there's lots of different types of inhalers, and they all require a different inspiratory effort or a different strength of your breath in order to get that medication into your lungs. Because if you're not taking the medication correctly, you know, if you're taking too big of a breath in for that certain puffer, or you're not taking a deep enough breath in, then you're not really going to be getting that medication into your lungs where it needs to be, right? So, and you know, that could be for a variety of different problems. So if you have a certain inhaler and you're not able to generate a nice big deep breath in, you know, whether that be because of the severity of your COPD, whether you have some sort of muscular problem that, you know, you can't generate that big deep breath in, this tool here will help us kind of get an idea of how you're taking your inhalers without actually having to, you know, take your inhaler and taking multiple puffs and doing teachings that way, and avoid kind of getting too much medication by training with the actual inhaler. So you can see at the top here, there's a bunch of different symbols. All of these symbols kind of relate to every different kind of puffer. So we have a little arrow here, and right now I have the arrow lined up with the circle. The circle demonstrates kind of what this is an MDI. So it basically acts as the resistance of this MDI here. So what we do is we take a one-way valve here. We use a different one for each person. This one's mine. And we just put it at the end here. You can see there's little weight at the bottom here. So we kind of just reset that weight. And I got the circle measured up to the arrow. And what you do is I'm going to take a breath in. So you can see that little red weight, it went all the way to the end here. You can't even see it. And it's way past the red even. So what that's telling me is that that breath that I generated, that big deep breath that I took in, it was way too strong of a breath. So that what can happen with that, right? If I was actually using my inhaler with that big deep breath in, that medication's kind of just going right to the back of my throat and not into my lungs where I need it to be. So I'll try and I'll demonstrate how I should be taking it. Set that weight here, and we'll try again. Fill out that circle there. So you can see where the red weight is now, and you can see that breath that I generated. It's not a big deep breath. I wasn't quite using as much strength as I did the first time. The red weight is actually almost in the red. But it's still in the green there, which tells me that that breath that I took in, I was taking it properly, and I was actually using the correct amount of inspiratory effort for this kind of puffer. So I'll just show one more time. So the purple symbol here, that demonstrates handyhalers, which are sometimes what you have when you have Spiriva. So it's a little pill and you crush it, and then you have to take a big deep breath in. And it's actually a dry powder as well. So that is the, you have to take the biggest breath in for that one. It does require quite a significant inspiratory breath in. For some people, you know, especially people when their COPD is more severe and they're just not able to generate that big deep breath in. I often see some of my clients at Northern Respiratory, they do actually have that puffer. And when we do this test, I can tell that they're not actually able to generate that big deep breath in just because they're constantly so short of breath, right? But they would have had no idea otherwise. So I'll just show you, for example, well, so now that red weight there, it didn't make it to the green. So that's telling me if that was the biggest breath that I was able to generate, it's not sufficient enough to get that dry powder into my lungs and deep enough into my lungs to actually work. So what we normally do is we do 3 tries for every person. And I'll say, okay, let's see if you can generate a bigger breath. If you're not able to, then what I would do, you know, is I would, you know, get in contact with your physician and maybe let them know that, see if we can switch up some of your medications, because there are many different inhalers now. And, you know, get one that works for you, that you are able to inhale. So it's just a cool tool that we started using. I bring this to every appointment that I go to now. I take a look at what inhaler my patients are using. And, you know, I line up the symbol correctly to the arrow, and we do 3 tries and just make sure that whatever breath they're taking in is appropriate. And some people, like I said, they just take a big, huge, deep breath in because I think that that's the answer. But oftentimes it's not, because you're actually taking too big and too deep of a breath in. So that's this. And the next one I want is our portable oxygen concentrators. So that's this guy here. I'll take it out of the case for everyone to see. So if you've ever known anyone that has had oxygen in the past, you might think of tanks and those big heavy tanks that you have to lug around and get exchanged by the oxygen vendor. Instead of those tanks, this is what you can have instead. There is 2 different sizes. There's this one here, and we also have the smaller version as well. This one is about 7 pounds. It's still pretty light, whereas this one is about 4 pounds. So very light, you know, really nice for those people that need oxygen, but still want to stay active, because you don't have to lug those heavy tanks around, like I said. They are battery operated, like Chris had mentioned earlier, and that's where all that weight comes in. But the beauty of them being battery operated is that they're rechargeable. So I often say, you know, you can think of it like a cell phone or a laptop. There is a battery life on them, and depending on the level of oxygen that you're on, the battery life will depend on that, right? So if you're on the lowest level of oxygen, this machine here, manufacturer says it can last for up to 13 hours. I say manufacturer says that because I often tell everyone to, you know, take off a few hours. So if you know you're on level, if you're on the lowest level, I would say this one lasts for about 10 hours. So it's just plugged in at the, it's just charged with this little plug-in at the back here. And on the screen, I'll turn it on for you. So this is what it looks like. They've made it very easy to use, really few buttons, so that there's hardly any room for error. So I don't know if we can see that, but there is the battery display here. So you can see how much battery life you're at. This one's almost fully charged. So it is, you know, something that you want to look at just like you would with your cell phone or your laptop, right? The machine does work while it's plugged in. You can plug it straight into the wall outlet, or you can also plug it into your car charger as well. We're just a cigarette lighter there for when you're on long trips, or, you know, if you're going back and forth to appointments and things like that. The car charger is a great tool to have, just in case you're not, you know, inside, where you can plug it into the wall. You can see here, this one, we can change the level of oxygen. And what I'm changing here, it's not like the oxygen that you'd get at the hospital, say, or through certain tanks where that oxygen is consistently coming through into your nose and you're breathing that in, where it's a constant flow. These machines, because they are battery operated, they deliver oxygen in pulse doses, it's called, or you can think of it like a puff of air. So it's a really smart machine. And what it does is it actually senses when you're taking a breath in, and with every breath in, it's giving you a puff of air. So, you know, you'll often be able to feel it with every breath in. It's a puff of air, as opposed to oxygen constantly going through the tubing here. Yeah, so those levels, that's just the size of the puff that it's giving you. So obviously with a bigger puff size and a higher level, the quicker the battery will run out. And you know, it's just standard thing with the nasal cannula here, if you've ever seen this at the hospital. Super easy to use, just goes in your nose, and you'll have those puffs going into your nose when you put it on. I find it kind of, you know, makes the whole thought of being on oxygen, if you do need it, you know, as COPD progresses, some people do require oxygen just to keep their oxygen levels up. And a lot of people, you know, you feel like you're losing some of your independence when you get oxygen prescribed to you. Whereas these machines, you know, they help you keep some of your independence and make it quite easy to live the life that you were living, because now you don't have to carry anything around. You got a pretty aesthetically pleasing little carry case to carry it around with. You know, we also have backpacks. We have like little fanny packs that you can put them in as well. So I think that those portable oxygen concentrators, they are just a great replacement for the tanks that we used to give out, so that it's not as scary if you do need oxygen or you do require oxygen. That's a whole nother story about why it's important if you need oxygen to use the oxygen. But yeah, I just kind of wanted to show everyone some options that do exist now, and you know, if you are in Sault Ste. Marie and you know anyone, we do, that is what we give away. We don't actually use tanks at all unless you do request to have tanks where you live kind of in the bush or far away or anything like that as backup. So yeah, that's kind of my spiel anyway. So yeah.
Thank you very much. And I think, yeah, I forgot to end sharing the screen initially. I think Gloria must have taken care of that.
Okay.
But you can be very small in the corner,
Yeah.
so I guess that's what's happening here. So. Thank you for doing that. So now, if there's any questions from anybody, this is the time to post them in the chat if you do have any. Let me go as well. There's just a couple extra slides just to show you quickly. So that was the, yeah, this is kind of a cool, maybe you can explain that.
Yeah.
You can hardly read it.
All the different symbols, they line up with all the different inhalers. You can see on the high end there, so with the 3 little waves or 5 little waves, the things like the hand inhaler, which Spiriva sometimes comes in that form.
We can't hear you, Gloria.
Oh,
I can hear somebody. That's all right.
Sorry. No, Kori, you maybe speak
Yeah.
directly into the mic because it's a little hard to hear.
Oh,
Oh,
the mic's like somewhere there.
On the
Okay,
laptop,
sorry.
like in the center of the laptop. Thank you.
okay, yeah, sorry. So like I was saying, you know, you have the symbols on the InCheck dial, and they just line up. So basically what I do is I'd look at this diagram here, and I'd find which inhaler you have. And depending on the color, I'd line it up with the arrow here at whatever inhaler that you have. So like I said, say if you have the hand inhaler, the Spiriva, that's that purple one there, which is the highest resistance and requires the biggest breath in with the most inspiratory flow. I'd line it up there with the arrow, and what that does is the InCheck dial just mimics that same amount of resistance that you'll feel with that inhaler in here, so that when you go to breathe in, it kind of mimics what it would feel like to breathe in through that inhaler, and lets us know whether or not that breath in that you're taking is sufficient or not, or too sufficient if it's too big of a breath in. You know,
If you have more severe COPD,
exactly, yeah. And I have had that happen, you know, where some of my clients had the more severe COPD, the emphysema in particular, right? Because you get a lot of air trapping, so it's difficult to take that big deep breath in. They just weren't able to generate enough inspiratory flow in order to get that medication, and we did end up changing them to the Respimat, which you can see is on the lower end of the resistance, and it actually really did help with some of their COPD symptoms. So yeah, it's a great tool because inhalers are really important, and if you're not taking them correctly, and you know, sometimes your doctor, they just prescribe an inhaler, you go to the pharmacy, you pick it up, and you take it however you think you're supposed to take it, right? Without having proper teaching. So that's where this really comes in handy anyway, that I've found, so.
Cool. Yeah. So actually, this is the last slide here. So where can I learn more? So we do have our lung health line, certified respiratory calls, and by live chat at lunghealth.ca, and you can also email questions if you prefer that.
Chris can't hear you.
So yeah, so I'm going to stop sharing now, and let's see if there are any. You can't hear, eh? Okay, yeah, well, yeah, I mean, it's hopefully you heard most of it. So do you, and does anybody there have any questions? We still have time for questions. Best to post them. Unless Gloria is unmuted, folks, you can post them in the chat. Otherwise, yeah. I don't see any questions at this point, which I take as meaning I've covered everything so well, which is great. But if you do ever have questions, you know, of course, you can always reach us, and you can answer them. We're there Monday to Friday, 8:30 to 4:30, and aside from the usual holidays. So yeah, that's it then. So thanks for everybody for joining, and I'm going to sign off then, and appreciate you spending your time here today.